For this poster presentation, I will be discussing Chapter 8 in our textbook, and it is called Sexually Transmitted Diseases. The rationale for deciding this chapter was the theme and message presented in Tyler Perry's Temptation. So to provide a brief overview of the film, Temptation is about a woman named Judith. And Judith is married to her childhood sweetheart. She was raised with strong Christian beliefs. She grew up in church, and she did not believe in premarital sex. Judith is working as a marriage counselor in a dating agency where she meets Harley, whom she eventually starts having an affair with and contracts HIV from. So from this movie, we were able to develop a case study looking at both a woman who is married and contracts HIV from an affair, and also we're able to analyze a man who is living with HIV, not disclosing his status to his potential partners, and infecting others. The discussion. Here I have listed an overview of the main topics discussed in Chapter 8, and I'll go over each of these. The first topic that was discussed was stigma surrounding STDs and STIs. And the word stigma means the general perception the community might have of people with STDs, their thoughts and perception of them. And this is important for counselors to know because these are all burdens that their clients may carry when they come in for a session, and this is something that they'll have to work through during a session. Next are commonly described STIs, so counselors must know signs, symptoms, and treatments when working with a couple or individual that experiences one of these diseases. So also in Chapter 8, there was listed a process for sexuality counseling for couples. And this process seemed like it was a case-to-case basis, but it did just give a general outline, which talked about going over diagnosis with partners, interventions with couples, dealing with that, which we'll go into later in the presentation, and a guideline that counselors can follow. Like I said, interventions, and also safer sex and STI prevention methods were discussed in this chapter. Methods. And to further add context to this chapter, I was able to find a research study that examined the effects of counseling on HIV-positive men, and the study looked at whether counseling played a part in men disclosing to their negative partners their status. So in the film, we saw Harley not disclose to Judith, and we don't know if Harley received any counseling after his diagnosis, but according to this study, preventative counseling of 255 HIV-positive men was associated with self-disclosure to negative partners. Men who reported seeing a professional counselor after being counseled at their HIV clinic were more likely to disclose to negative partners. So just a summary of those results, these findings suggest that counseling interventions for HIV-positive men, when delivered by multiple sources, may provide an effective means of increasing disclosure to sexual partners. Now, the implications of this study. The implications of this study are that sexual educators, therapists, and counselors can potentially play a critical role in STD and STI prevention. So here I have listed some of the treatments that will go into the treatment plan for a couple or individual that comes in for counseling with a sex therapists. And one of the treatment interventions was telling a partner. Now, a counselor may work with a person to go over how they're going to tell their partner. They might want to, everyone is different, so they may want to develop a script or just know what they're going to say, discuss any feelings of anxiety, depression that they may have about telling a partner. But working this out with the counselor beforehand increases people's chances of being safe and being vulnerable and letting other people know their status before getting into a sexual relationship. Education is also used as an intervention. So education has to do with counselors providing clients with STD information as far as transmission, the risk of transmission, how to be safe, safe sex practices, and more. And so for the next treatment, we have modifying sexual practices. So, for example, if a client comes in and they have herpes and their partner doesn't, they may need to modify their sex routine. They may only have to have sex in between outbreaks or use protection during outbreaks. So these are all uncomfortable feelings that can be discussed with a counselor. So a counselor may also help clients learn how to manage their outbreaks. So they may need to go on a stress reduction plan. They may need to start medication. They also may need a referral to a doctor or a clinic to make sure they are getting their medication. And also, of course, they'll be identifying and exploring feelings. Next, we have challenging myths. This also ties into the stigma piece that we talked about earlier surrounding STDs. Many people suffer from a lack of knowledge from STDs, so when clients get them, they might not know what's next, or they think their life is over, they think they won't be able to have a baby, they think they won't be able to get married. So it's important for counselors to help them know you can have, a satisfying, meaningful relationship, but it's going to be based on you being open and honest with your partner and you being able to discuss some of those scary feelings. And next, we have identifying long-term impact. So the long-term impact for an STD is going to be different for everyone, but there are some general, long-term effects as far as their sex life. They will need to learn how to disclose to partners. They will need to learn how to be safe and how to stay healthy and keep themselves medicated if needed, and know how to keep themselves and others healthy. Next, we have multicultural competencies. So just a definition, multiculturalism helps counselors gain insight into the inequities experienced by clients from marginalized groups. Now, for this particular client base, multiculturalism is very important because certain clients may have STDs due to poverty, lack of access to health care. STDs are higher in certain minority groups. So counselors must be aware of all of this information. This can be done through research. I also have listed a few ACA Code of Ethics that state multicultural and diversity, how it must be identified in a counseling setting. So in conclusion, individuals and couples living with STDs and STIs benefit from empathetic and informative sexual counseling. Counselors must be comfortable discussing diagnosis, symptoms, relational and sexual problems, implementing interventions, and recommending safer sex practices. And below is a reference to the case study I discussed. So, thank you everyone for watching. Goodbye.